Hey guys, it's Ponce here. I'm a medical student and an academic scholar from the University of Santo Tomas, Faculty of Medicine and Surgery, and I'm on my second year studying Doctor of Medicine. I'm also a content creator on YouTube, Instagram, and TikTok. You can check it out at JamGPonce or JamPonce. So I mainly focus on medical school, academics, scholarship, beauty, lifestyle, and fitness. And today, I'm so excited to do this procedure with Dr. Contessa. So I've known Dr. Contessa way back when I was in high school. I knew her through my friends and family mostly because they would go to her for consultations and procedures, and I'm a really big fan of her ever since up until now because as a medical student, you look up to her so much. She's such a great dermatologist. She's known worldwide and here in the Philippines as well. So my main concern, that's why I went here today, is my acne, or because my face is very oily all the time. And it's been an insecurity of mine ever since due to medical school, the stress. I don't sleep that much. I don't eat healthy, which is super stressful, and the acne just it just comes here and there, and it just degrades my confidence. That's why the procedure that's gonna be done to me today, which is gonna control my oiliness in my face and also my acne, is just gonna help in my confidence. So guys, don't forget to click the subscribe button and like down below as well.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, let's talk about acne and its prevention. But before that, let's all welcome Miss Jam Ponce.
Hi guys, it's Jam Ponce here. I'm so blessed to be with Dr. Contessa today.
Yeah, likewise, Jam. So, how young are you?
I'm 22 years old.
Taking up medicine. Second year.
Yeah, I'm a medical student and also an academic scholar from USC.
Yay!
So I'm studying for doctor's medicine.
Meron tayong aabangan.
Nako.
Next, magaling na doctor.
My doctor is my idol po ever since high school. You know that, doctora? Nako.
Glory to
Kaya
God
po,
po.
sana in the future, I could be like her.
Okay, hindi malayo yan. And so, Jam is here with us right now. Since, look at her beautiful face. She's so pretty. But since she's a medical student and doesn't sleep, med students, I heard don't sleep, okay? So they get this acne problem.
Everywhere.
Right? So now, talking about pimple or acne, what is acne? Well, the definition actually is that it's a chronic inflammatory condition of the skin, which is specifically the pilosebaceous unit. Pilosebaceous, so involving your sebaceous glands or oil glands, as well as that part of the hair follicle area. Okay, so that's where it originated. Okay, in that unit, in that system. But then of course, what will cause it? What are the factors causing it, right? Yeah, so Jam has an idea already. She mentioned about the bacteria. So the specific microbe is a so-called Propionibacterium acne, yan, or P. acnes. Or they call it now QT, Bacterium acne or C. acnes. Okay, that's one of the pathogenetic factors. Okay. Since there's this microbe that we're talking about, of course, it will lead to inflammatory processes. And How is that? What's the mechanism? The microbe actually, they release this certain enzyme lipase. You know lipase? It's an enzyme that will degrade the triglycerides. Where did that come from, the triglycerides? The sebo, the sebum. So, in our skin, in our face, sebaceous glands, they produce sebum, oil. And then you have there the triglycerides. So, your lipase will catabolize the lipids or the triglycerides, producing now the fatty acids. Now, the fatty acids are also irritants to the skin. They will irritate the skin, causing the inflammatory reaction. So, inflammation. What are the things in inflammation? The signs. Redness or erythema, swelling, edema. Ayan. So, what else? Pain, heat. So, those are the cardinal signs of inflammation. So, the second factor is the inflammatory process. Okay. Well, actually, initially, the most important factor, yung overproduction of sebum from the sebaceous glands. Sabi nga nila, oiliness is next to pimpleness. If you have oily skin, yan, you're prone to exactly the overproduction of the oil. And when you have too much of that sebum, they will clog the skin pores. So clogging of the skin pores, blockage of the skin pores, then you will see those bumps. Because they cannot go out eh. And another thing is the so-called hyperkeratinocytosis, the keratinocytes. Ayan. Medical, no? Kasi nagdodoktora po tayo. Matalino. Okay. So, the keratinocytes also accumulate in those skin pores. Imagine, no? A lot of those molecules, a lot of those cells, those substances accumulating in those skin pores. Then, clogging that, blockage of that. Then, you form those tiny bumps. Ayan na yung comedones. Yung blackhead, whitehead. Yung blackhead, open, comedone. Why is it black? So there's an opening on the crater. And then with the air, the oxygen, it will oxidize the sebum, those thing that is inside, causing the black color. Oxidation.
Melanin a factor po ba?
Yeah, actually there's also the melanin factor there. There's a pigment also there. Because in the hair follicles, actually, around that, you still have the melanocytes there. Okay. An injury to the skin or some trauma or some inflammatory process, they also stimulate the melanocytes. Okay, ang dami nating natututunan. So we have three factors na, no? Yung sebaceous gland overproduction, bacterial infection, actually inflammatory processes, as well as the, four na pala, hyperkeratinocytosis. And we've discussed yung about the lipase, producing those fatty acids that will irritate your skin. Okay, those are factors internally eh. But right now we have the external factors. Exogenous factors, and what are those? Common now, acne. Okay, so the mask is like an external irritant to the skin. Imagine you wearing it, like the others are wearing it the whole day. So there's like a blockage also of the skin pores. Anything that will block the skin pores. The women wearing makeup, especially comedogenic makeups, right? Anything you put on your skin. And lipid-based products, oil-based, even vitamin E cream. Yan, di ba? So, they will close those pores. Kaya nga, those things, you really have to think of as external factors causing your acne formation.
When it comes to food, doctor, it's like a problem.
Well, they were saying high glycemic index diet. Too much of sweets, dairy products. Yeah. Before they were saying there's really no clinical evidence, no? But right now, they implicate the high glycemic index diet daw. Dairy products, or even fatty or greasy food. Diba? The others eating peanuts or yung mga prito-prito, yan. So, acnegenic daw. That's why they were saying if you want to have a glowing skin, you have to take yung mga fruits and veggies. Eh. Go, grow, glow. Glow, diba? Fruits and veggies. And a lot of water. Hydration is very important. So, we've learned a lot of things in terms of the acne and its causes, right? And so, ano ba yung management natin? In short, what are we gonna do for JAM? Okay, so ating abangan sa pabalik ng CSA Medical Aesthetics. And we're back mga ka-CSA. So we're doing a procedure for JAM. So let's assess first. Okay, so the acne problem, we have over forehead region, over the lateral cheeks, and then the mandibular line, and some on the cheek region. So basically, she has like a combination T-zone and U-zone. right, Jam? So since she's a medical student, I've actually observed among the med students right now that they suffer from this acne problem. Okay, so it's the stress factor. Okay, so when you have to really delineate areas with the acne zones, so look at the all over face region. Okay, so the treatment that we will be doing for Jam is the so-called Microtoxin injection using Incobotulinum toxin type A. Okay, because there are several types of this botulinum toxin. So the ones that we use, type A. Okay, so we'll be starting with the forehead region. Okay, and then I have the Incobotulinum. I did a dilution. Okay, and then actually there's a video showing you how we diluted it. But for this kind of treatment, it's gonna be hyper diluted, and the plane of injection will be intradermal. Before doing any procedure on the face, of course, you have to really cleanse the area, disinfect it, okay? And we also applied topical numbing cream a while ago because we'll be using tiny or micro injections, okay? Are you afraid of needles, Jam? No, that's very good, okay? So again, I'll be using Incobotulinum toxin type A for the control, for the prevention of our acne. Okay, so why botulinum toxin type A? Any ideas, Jam, that you can share?
It's botulinum toxin for ano po?
What have you heard about it?
It's usually used for cosmetic procedures.
Yeah, that's the thing that we know. For wrinkles,
Yeah.
for lines, but yes, there was a study that was presented to us that it can also be used in controlling sebum production, oiliness.
Just
Yes.
lang po, no?
Yes, and also for the closure of the pores or tightening of the pores, skin pores, or reduction of the size of the skin pores, and also for skin lifting, facial lifting, skin tightening, firming. Okay, and how? What's the mechanism? That's the important question, because we doctors, we should really understand the mechanism of action. How come we say that it's controlling those acne sebaceous glands, the sebaceous gland producing sebum? What do you think?
Immobilized po.
Immobilize. Yeah, that's wonderful. Because basically what we know about this botulinum toxin is that it really works on the muscle region, on the myoneural junction, okay? The nerve and muscle junctions, okay? It's more of the acetylcholine control. So your acetylcholine will not be released to go into the muscle receptor, so it will not contract. So with this one, with the sebaceous gland, it also will control acetylcholine receptor so that it will not stimulate a sebaceous gland to secrete sebum. Make sense?
Yes po.
Okay. So they were saying nicotinic receptor, alpha-1 type 1 receptor there, okay? I'll be starting on the forehead. So later on, we'll still be discussing, okay? Now, technique-wise, intradermally, so center first, I'll be just injecting micro doses, okay? Small doses only. And take note, it's intradermal, okay? In the dermis region. So we're not gonna be doing intramuscular for this one. Now, the ideal thing here is you make a bleb, this blanching effect on the skin. So you know you are in the dermis. Sorry, Jam, ha? So they were saying daw, no pain, no beauty. Tiis ganda. So just create those tiny blebs. Okay, again, this is only for medical doctors, aesthetic medical doctors trained to do these kinds of aesthetic procedures. Please do not go to non-MDs, those unlicensed practitioners, right, Jam?
Yes po.
Yeah, so you have to
Double check.
correct. You have to go to School of Medicine, like Jam here. She's studying Doctor of Medicine in the University of Santo Tomas, UST. Yeah, actually the pioneer school, right, in
Yes,
medicine. So we have a lot of experts from UST. Okay, so I have done micro-injections of our Incobotulinum toxin on the forehead region, I can proceed to the mid-face section. So we'll also be working on the cheek area, okay, anterior cheek, anterior-medial cheek. Well, basically, you are highlighting on the regions of the face where, like those women doing makeup, areas where they highlight, diba? Center-wise, and then yan. Yung highlighting, they call it highlighting. So you highlight those regions only. Now with this section here, okay, I have like this syringe of Incobotulinum toxin hyperdiluted, and actually this is mixed 10 unit. Okay, so we'll be doing half and half of this one. Okay, so for some of our doctors who wanted to do trainings on this, you can actually have training of such a procedure with the company providing the medicine. Okay. So again, intradermal approach. Okay, just a tiny bleb there. We're not in a hurry. We have all the time in the world. And another benefit that you get from this is the closure of skin pores. Now, the question is how? No, Jam. How did it do that? Magic? Okay, they were saying that there's this study indicating that it also inhibits these erector pili muscles. And aside from that, it stimulates the fibroblast cells to synthesize new collagen fibers, so that you'll have closed skin pores. Okay, so far so good, Jam? Actually, we had previous episodes already whereby we presented this kind of treatment. And one episode, we were asking a question about hair follicles, especially in the paranasal region on the sides of the nose. Because some individuals, you can see tiny hair follicles on the sides of the nose. So the one episode that we did, actually when she followed up, we noticed that there's a reduction in the hair follicle. Wow, amazing. Because something to do with that inhibition of the erector pili. Okay, actually the erector pili is attached to the hair shaft. Remember your physiology, anatomy and physiology of the skin and its appendages. Remember that? Yeah. So I think you're still going into clinical subjects. So again, this is intradermal. And my angle is 15 degrees, and I'm just creating tiny blebs and those tiny injections. So just imagine highlighting the areas of the face where you wanted to have those better skin texture. Sorry, Jam. I noticed Jam is turning red already. It's normal. Erythema, hypererythema, which is a normal response. Okay, so we're done with the anterior middle cheek. Now let's go to the lateral cheeks, or the posterior aspect of our cheeks. So you can actually use 10 units on one side, 10 units on the opposite side. So again, for the forehead, 4 units. For the anterior cheek, 5 units, 5 units. So now we'll go to the side, 10 units this side here. Okay, make a linear injection, make a 2 columns here. There you go. So for some people with temple acne also, you can work on the temple region, but basically you wanted to target areas that's really prone to acne formation. So this is just creating tiny bleb. So intradermally. There's also this question that when you inject in the anterior cheek, are you not affecting the zygomatic muscles? The muscles that will also make us smile. Of course, that's why you are in that dermal region. You don't want to go into the muscular layer. So as doctors, physicians, anatomists, we know this. We know what is the anatomical depth. That's why don't go to non-MDs doing procedures like this, okay? For safety. Tama, Jam?
Yes.
Okay, so let's proceed. So just make linear or a column of your injections here. So again, the goal is to control acne formation via inhibition of our sebaceous glands and also stimulation of fibroblast cells to synthesize new collagen and inhibition of the erector pili muscles. Okay, so let's proceed to the opposite side. Jam, are you still okay?
Yes.
We're nearing the end. Actually, we're on the opposite region. Then after this, we'll do the mandibular area. So it's a technique that's actually simple for our doctors. So for cases whereby when you manage their acne and it seems like it's not responding to your regular management, this is one additional treatment that you can also provide to your patients. So we're increasing our treatment armamentariums. So at least we have options. What other treatment modalities can we use in order to prevent, to control the acne formation? So again, this is not a direct or like the drug of choice for our acne, for active pimple, okay? We still have our like the isotretinoin, the vitamin A for our acne treatment, okay? But this one is more of the prevention, and at the same time improving the quality of the skin, also minimizing the pore size, and also rejuvenating the skin, anti-aging, also skin tightening and firming. So we'll go to the mandibular region. So I'll work on the right side first. So this one we can give a total of 20 units here. Okay. So again, you can do your intradermal approach there. Just 5 injection points in this area. Okay. So actually, you can also target the platysmal muscle here, inducing the so-called tightening and lifting, mandibular lift. Okay. And then we'll proceed to the opposite. This lang, no? So Jam is doing okay. So we're proceeding to the left mandibular area. Okay. So a linear horizontal 5 injection points here, okay, creating your pleb. Okay. So again, try to avoid the muscular layer. You want it to maintain in the dermis layer. And the others were asking about diffusion of your medicine. Well, since we have a hyperdiluted type of medicine of Incobotulinum toxin type A, so we're not afraid of like this one affecting the muscle function. Okay, we can also do the chin. So small amount on the chin only. And we're nearing the end, Jam. Okay ka lang? Okay, and this one you can inject also the mentalis. And we're done! So yes, that's the Microtoxin intradermal injection using the Incobotulinum toxin type A. Okay, we'll show the result to Jam when CSA Medical Aesthetics return. We're back, so we'll now show the result to Jam. So Jam, here's the mirror. Oh, actually we did multiple injections, tiny injections, okay? So expect to have some erythema or redness, okay? So here's the mirror.
Yeah. Oh my gosh, it's so nice.
Yeah, so we did
it's
injections.
Glowing,
actually, yeah, the forehead, the cheek, lateral cheeks, mandibular or jawline region, even a portion of the chin, okay? So the goal of this Incobotulinum toxin injection is to target those in the dermis where we have our sebaceous glands and also the fibroblast cells to synthesize new collagen, and also some of those, the pilosebaceous unit, the system, that's the target of this type of injection techniques. Okay, that's why we are intradermal. And with my injections, actually I'm trying to also avoid the deeper layer. Of course, we don't want to go into the muscular layer. Okay, so take note for our aesthetic doctors, you just want to stay at the right anatomical depth. And take note of the areas on the face where you wanted to do some highlights or like improve the quality of the skin. Okay, and areas where you see a lot of those acnes. where they usually form. So for jam, we mentioned that it's both T-zone and the U-zone, okay? We know, especially the T-zone, that's the area where we have a lot of our oil glands or sebaceous glands. And then on the U-zone, we always associate it with hormonal factors. Okay, that's why some cases we still advise some hormonal management at the same time or co-management with gynecologist. Okay, so now in terms of the skincare, so Jam has this set of cleansers, toners, also some morning and night topicals. Okay, something to also control the Propionibacterium acne or inhibit the microbe. So you have like either benzoyl peroxide or your clindamycin, erythromycin, or other doxycycline. Some people are taking oral antimicrobials. And also, what else do we need to add? Okay, the adapalene. Okay, the line of those retinoids, the retinoic acid. Okay, they target the sebaceous glands. So adapalene is one of them. Then we have the tretinoin. Actually, the adapalene is less irritating than the stronger ones. The tretinoin, there's also the oral isotretinoin. We give that for the severe cases, those who are resistant to the topical management. Okay, so ayan naman, so far so good. Okay, I'm trying to look for some injection marks. A while ago, it was so obvious, but little by little, it's gonna go away. And then tomorrow, okay, the others, they were saying that it was okay the next day already. They're starting to see or observe like the pore size is being reduced. So there's already this decrease in the size of the skin pores. Yes, and they were reporting like a reduction in the oiliness of the skin. That's the goal actually. Again, the injection of the hyperdiluted Incobotulinum toxin type A, it's not really the direct therapy or the management for acne. We have other lines for management of that one, but this is being used mainly for the prevention or the control. Okay, the control of the oiliness, and also to reduce the pore size and induce also skin tightening and firming. Basically those ones. So this kind of treatment is an adjunct to the other types of management that we give for acne control. Okay, so I don't say that it's the main line of treatment, but you can also do this. We also have other like devices, energy-based devices, lasers that we can also use. Okay, Jam, can you share anything to our televiewers?
So guys, you have to get this once you have like acne or oiliness in your face, especially if you can't control it with your skincare or with your diet or with your sleeping pattern. If you're someone who's working long hours or who's a medical student like me, it's a procedure that you would really need. So I'm so thankful and honored to be with Dr. Contessa, who's a really known doctor in the Philippines and also worldwide. So guys, go to her if you're here in Pampanga. Just check her out. She's near Marquee Mall. So thank you so much, Dr.
Thank you, Jam. Okay. Regarding the how long will it last? Because some people are asking. Okay, we do a repeat treatment like after 3 months or the others after 6 months. The others that we have done this in the past, actually they reported improvement in the acne control as well as the skin quality and the pore size. Okay, so I think you can see all those episodes, the other ones we have done in our YouTube channel. Just type Contessa Salvador Alapag. And then if you have any other questions, you may email me at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. We have our Instagram, CSA Medical Aesthetics, as well as the FB page, CSA Medical Aesthetics. What about Jam? Do you have any your social media account so they can also ask questions
if you want to check out my Instagram, it's @JamGPonce. You could direct message me there, or I would be posting the results in a few weeks, what it will look like in a few weeks and a few months, so you would see it. Also, I have TikTok, it's @JamPonce. It's Jam Ponce with 3 E's, and also I have YouTube, it's Jam Ponce, which I'll be uploading a part of this as well in my blog. So thank you so much.
Thank you, Jam. Thanks to you all.
Thank you so much, guys.
So, God bless you po. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.